3.
Most people think first of breast cancer when they think of diseases that affect women. I know that I do. Did you know that there is a much deadlier disease that women should be concerned and educated about? 1 in 31 women die of breast cancer, but 1 in 3 die from cardiovascular disease. I found an article that stated that cardiovascular disease was responsible for more deaths in women than all forms of cancer, chronic lower respiratory disease, and Alzheimer's disease combined. So today I would like to tell you about the article I found that shows that women are not recognizing cardiovascular disease as the killer it is, and they're not being educated properly on its prevention. My information comes from the article Update on Cardiovascular Disease Prevention in Women. It was written by Miriam Cabral. This article was published in the American Journal of Nursing. Being a woman, this article really caught my eye. I wanted to see what I need to be looking for as a woman when dealing with cardiovascular disease and its prevention. I wanted to know if there are ways I should be treated differently for cardiovascular disease than a man. I will explain why this article was written, the findings of the research included within the article, and the general guidelines that this article and the American Heart Association recommend for women. The author of this article wrote it because women are misinformed about the dangers and deadliness of cardiovascular disease and the ways they can reduce their risk of developing heart disease. The information in this article comes from various studies and surveys and the new guidelines released by the American Heart Association. The article also discusses the differences for men and women in the way cardiovascular presents itself, is assessed for, and responds to treatment that may be prescribed. The findings in the article were very interesting and enlightening to me. Although the cardiovascular disease is commonly referred to as a man's disease, women made up of more than half of the deaths from cardiovascular disease in 2008. A survey was completed in 2009, and just little over a half of the women surveyed realized that cardiovascular disease was the leading cause of death in women. Most of the women surveyed also were under the impression that they could reduce their risk of heart disease by using products such as multivitamins or aspirin in younger women to help prevent cardiovascular disease, which is not true. Women respond differently. Women actually present with cardiovascular disease differently than men do. Women may not even have chest pain. Women may delay seeking help because they do not have typical symptoms of a heart attack or other cardiac problems. Finally, I want to discuss a few of the updates that were made by the American Heart Association guidelines for preventing cardiovascular disease in women and some of the comments that I have. One thing I found interesting in the article regarding the American Heart Association guidelines was their determination that cardiovascular disease and some of its risk factors actually develop in a person early in their life. Many people see heart disease as something that the elderly have to worry about and not younger people, which is not true. Women need to be assessed for the risk of cardiovascular disease in ways that may be a little different than men. Women definitely need more education regarding the ways to prevent and decrease the risk for cardiovascular disease, and women may require different medications and dosages of those medications to treat cardiovascular disease than what a man may need. The American Heart Association has recommended 3 types of interventions, which include lifestyle interventions that are for all women, major risk factor interventions that are for at-risk or high-risk women, and preventative drug interventions for women who have a predisposing condition. In my opinion, I think the American Heart Association guidelines will help women and caregivers understand better how to prevent cardiovascular disease in women. I do feel we have a long way to go still. I think I will try to educate myself and women that I know more about the risk factors and prevention of cardiovascular disease. I told you about the article that addresses the differences in symptoms of cardiovascular disease in men and women, and its treatment and prevention. I discuss why the article was written, the findings of the research, and the general guidelines of this article and the recommendations of the American Heart Association. I try to eat as healthy as I can, and I've started exercising on a more regular basis, and I try to get or keep my weight as close to what is recommended as possible. I would just continue to keep educating myself more and hopefully prevent myself from having heart disease.